gonna get it recorded for us. Thank you. This takes a village with me to get this going and completed, so I appreciate all of the help. And then we can talk about, if we want to, if there's any challenges or things like that that you're facing. And then I thought we would have an opportunity to do a go around and make sure that we're checking in with each other without getting political. Would like to talk about if there's any challenges or things that are impacting you or your agency, or even people that you're serving. But again, I would like us to keep the politics out of it, as far as any blame or anything like that. It would just, I think if we can keep it on how can we help people, that will be a mindful way to navigate what can be a really challenging time right now. So that's what I was kind of hoping that we could do. And if there's any announcements that you have when you do the go around, that would be fine to do. And I asked Jan to come and talk because some of you know that I've had a lot of family members in and out of healthcare, and I was really surprised when I was at one skilled nursing facility that the PT, I think she may have been new, wasn't familiar with the lending closet. I probably got the wrong name of that, Jim, but that you can borrow the equipment. So I was like, ooh, I take for granted that everybody knows about Flick and how fantastic they are. So that's why we asked Jan to come and talk to us today. So I'm going to hand it over to you, Jan. Just make sure everybody's putting their name in the chat for us to do attendance. Thanks.
Hi, I'm Jan Lynch. I'm the executive director at the Finger Lakes Independent Center. I've been there for 10 years. Can everyone hear me? Fine. Okay, good. I'm happy to be here today. I used to attend this meeting, but since we've had a New York Connects grant, we are happy that we have a staff member who does that and keeps me updated. So I didn't do a PowerPoint or anything like that. I'm just more of a talker, but not a long talker. So I'll get started. I wanted to first talk a little bit about how the independent living philosophy is a little bit different from the traditional medical model. In independent living, we view disability as a natural part of the human experience, and we're not there to fix people or make them any different than what they are unless they're looking for changes. And we emphasize self-determination, equality, and empowerment for people with disabilities. And we do that through having people who can advocate for you as an individual if you are using the services, as well as we do broader advocacy for legislative issues and other important issues that are coming up either in our local community or state and sometimes even federal level. So we try to remove barriers to community participation for people with disabilities. And when I say people with disabilities, it means anyone that feels they have a circumstance that in their life that makes them unable to participate or do all the things that they want to do. So it can be physical, it can be developmental, it can be substance use, it can be sensory, such as deafness or blind. Autism, we have a fair amount of people with autism that we help serve, and and often older adults will acquire disabilities as they age, and that's how we end up serving a fair amount of older adults as well. what I've noticed is often older adults don't think of themselves necessarily as having a disability. It's acquired, you know, as they age. So because they haven't had it throughout their life, they sometimes don't identify with that, and that's okay. We're just there to help with whatever they need help with. Yeah, so those are the general categories, but we don't ask for medical documentation of the disability. We are there to serve anybody who comes to our door and says, I need some help. And so it's not a big, long process. We do have an intake that gives us some basic information about the person, but it's not, it can be done in a half hour to an hour, depending on the person. So we're also looking for self-determination for people and full community participation. We believe that people with disabilities are the experts of what they need, not the medical folks or anybody around them making decisions for them. So we also operate with that general idea in mind. So someone may come to us asking for something, and if that's what they're looking for, that's what we'll work on with them. We don't necessarily say, well, we need to do this or that. Fortunately, our funding for most of our programs is flexible enough that we can help with a variety of needs. We help with housing, we help people with accommodations, we help them with understanding their rights and their responsibilities. We can help if they're running into problems with different types of applications. That's something that people often find daunting with good reason. So we can help with that as well. And we just want people to live as independently as they can and they choose to. So that's really what's behind what we do. And it is a little different than some service organizations that serve disabilities, but it's mostly in the philosophy behind it. We can still serve many people. So I mentioned that we do advocacy. We actually have a grant for that and a staff that works on that. So it's she works mostly on the statewide systems advocacy. But when you work with an individual person, a staff person here, it can be individual advocacy. Maybe you need to have an accommodations in your house or in your apartment, and you need to work with your landlord to get that accommodation achieved, and we can help with things like that. We're very flexible, so it's not like a list of only certain things we can help with. It's pretty much anything that you come in with. And if we can't help, then the thing we do is information and referral. So we try to be very conscious of what's in the what else is in the community, or sometimes state types of information or help that we can refer people to. And I'm trying to think what else. We are interested in keeping people out of institutions such as nursing homes. And that's where some of our aid services come in, because we believe those are a good service to help people remain in their homes, because most people will say that's how they want to age, or that's what they want to do with a disability. They don't want to go into some sort of nursing home or other facility. So we try very hard to make that happen for folks. And we can help with a lot of other things such as transportation, help them sort that out. We have a person who's a certified benefits advisor, can assist with that, and signing up for benefits as well. And there's a lot of services that I may not focus on as much because it may not be as relevant to folks that you serve or you're interested in finding more information about. For instance, we have a student transition person who goes to the high schools and tries to help different individual students and their families to think about what their goals are coming out of high school and help them plan for that. And that's very important. We have some employment programs, a couple different kinds. And those are to obviously help people to obtain employment, but sometimes it's also working out the benefits piece. If you know anything about the benefits having SSDI, which is a Social Security disability, it's pretty complex if you go back to work about how your benefits change. And so having a certified benefits advisor is really important for that. We also do community outreach. We will go to any other agency or business to talk about whatever they ask us to talk about. It can be talking about what we are there to provide if you need it. It can be talking about the ADA or, just any topic really. So I'll talk about a couple specific programs now. I'm sure you're all familiar with New York Connects, and right now Ben is probably on this call or on this Zoom. So Ben, there he is. He works at Flick and he's our New York Connect specialist. And of course, the Tompkins County Office for the Aging also has New York Connects service providers. And the main purpose of New York Connects is to provide information and assistance with long-term care services and supports that will help people of all ages and abilities and help them to stay in their homes. It's information, assistance, guidance, and often people don't know what's out there when they start needing help in their home, or they just need some kind of guidance to find the right fit for themselves. Another program we have is called the Registry, and that's a grant from Tompkins County Office for the Aging. And that is for people who are interested in having in-home help and are going to pay for it themselves. They're not eligible for Medicaid or other types of services. So that's called private pay. And we also have the aides come to us, people who are interested in being an aide. We have them fill out an application. We call references. We get an idea of what areas they can serve and what they're able to do, what they're willing to do, and keep a pretty detailed master list. So if someone calls needing in-home care and they live in Dryden, and we might have only a couple people that are willing to work in Dryden, or maybe they have dogs and their person might say they won't work with dogs, or they have a lifting restriction. So that's just a small idea of all the different categories that we look at to try to make the best match possible. But in the end, it's the person who wants care in their home who calls the aides, the names that we give them, and chooses who they want to work with. And the pay is negotiated between the caregiver and the person looking for some help. And that's a great program. We get quite a few people calling for that. We're always looking for more aides. So if you know of anybody who likes to do that kind of work, send them our way. And then we also have the expanded in-home services for the elderly. I had to look at my notes because I can never think of what that acronym stands for. The acronym is ISEP. But that's what it stands for. And that's for people who don't meet the requirements, the income requirements to be on Medicaid and get that type of service, but they need some in-home help. So that's something that Tompkins County Office for the Aging, that's another grant from them that we work with them. And we have an Alzheimer's respite grant that is through the Office for the Aging again. So they are great and a big help. one of the things we do that make it easier, I hope, for for the Office for the Aging is that we're what's called a fiscal intermediary. And that means that we can do all the logistics about signing people up, getting them on a payroll, getting their I-9, all those different pieces that need to come together, make sure they have the health requirements and so on. And that brings us to our consumer-directed and personal assistance program, which is also referred to as CDPAP, the acronyms again. And that program has changed a lot this year. I would be surprised if you hadn't all heard at least a little bit about that. It's been in the news. It's something that the governor decided to do in the last budget season. And that was to change from having individual fiscal intermediaries that may serve by region, or some of them serve all over the state, but there were approximately 600 fiscal intermediaries. And they wanted to go down to one statewide fiscal intermediary, which people had a lot of concerns with. There's many people that don't feel that this is a good move for a variety of reasons. But my main concern with this plan is that it's all supposed to be done by April 1st. And there are 250,000 people in New York State that use this program. And there are approximately almost 400,000 that are their caregivers. So enrolling that many people in a new system is pretty daunting when you talk about an April 1st deadline. And so far, the best they're doing is, I think, about 2,000 a day. And they want to jump to 5,000 a day next week. But if you think about it, it needs to be about 12,000 a day to get all those people signed up. So the other thing that we don't particularly think is a good idea is that it leaves people with no choice. There's only one, and it can only be one that you work with and get your aides paid through, and provides all these services. In the end, though, we felt as a group, there's 11 independent living centers who provide this service. And we felt the only way to be helpful to the consumers we serve and any other consumers we can help was to partner with the agency who is taking over for the state. They're called PPL. It's Public Partnerships Limited is what that stands for. And I should back up a little and just explain what CDPAP is for anybody who's not clear. It's an in-home caregiver service. They're sometimes called aides, but personal assistant is in the name, and that's sometimes what it's called as well. And the person who's getting the services, it has to be on Medicaid, and Medicaid pays for those services. There is a person who comes in from the state that determines how much care a person needs and will give them the number of hours they're authorized to use. And it also goes through Medicaid managed care, long-term care companies are involved in this as well. So what's different about CDPAP from regular aid services that you might be more familiar with is, first of all, you can choose your caregiver. It can be certain members of your family. There's a few exceptions to that, but in general, you can select someone from your family. The other thing that's different about it is if you train your aide and feel comfortable with it, they can do tasks for you that sometimes would require a nurse to come to your house and work on. So if you train them how to change your catheter or something like that, that's something that they can continue to do for you. which is great. And a lot of people like it because they can have the same person. There's always concerns that when it's a home care agency, you might get someone different each time, or you might not, they might have limits to what they can do for you. But certainly there's a place for all kinds of care in the spectrum of all the needs that are out there for home care. But this is just one of them. And we feel it's a really important one because it helps keep people out of institutions, which is one of our core driving forces that I talked about earlier. So that was backing up to explain what CDPAP, how people get involved with that. So a person might get 12 hours a week, another person might need round the clock care, and that's called live-in. And there's different rates of pay for that. And again, as a fiscal intermediary, we are providing payroll, we are billing Medicaid, and we're making sure all the forms are correct, that we have authorizations for the services. It's a lot of paperwork and knowing the rules. But with this change that's coming up, we wouldn't be acting as a fiscal intermediary. We would be acting as what PPL is calling a facilitator. And that means we can help people get signed up. We can help them with questions. We can do a lot of the things we did before, but we will not be doing the payroll and billing part of it. So yeah, and again, I have a hard time believing this is all going to take place on April 1st. I think no matter what the group is that's trying to do it, I'm not trying to disparage PPL, but I really don't think that it's really possible. And many people are protesting the whole thing, and there are lawsuits against it because they feel that the governor chose PPL unfairly, like gave them an unfair advantage, and that's kind of complicated too. If you're interested, there's a lot of articles you can you can dig up, particularly from Albany. There's going to be protests that are going on now that budget season and health committees are meeting. The main thing with the state is they don't want to reopen this statute for this change, because when they do, there's probably going to be a flood of other things that are lobbied for to get changed. So that's probably a lot more information than you wanted, but I did want to kind of give you the landscape of what's going on, because you may hear from people, questions, concerns. People do have to get registered, whether they're a consumer or an aide. They do have to go through this process. All of it is online. Most of it can be done on a smartphone as well. So we can help anybody who needs help with that. And we're trying to help all the people that are already signed up to work with us, but we can expand that to many more if needed. And we just hired Marianne Reeder, who some of you may know from the community, and she is working on those registrations. So I think that was probably enough information. I didn't talk about the loan closet and Try-It room because everybody seems to know about that. But I will say briefly, the loan closet is durable medical equipment that anyone can borrow. And if there is a financial barrier to someone having equipment that they need long-term, we can gift it to them as well. And it's things like walkers, wheelchairs, transport wheelchairs, commodes, showers, benches, tub benches. It's a wide array of things, bed rails, canes, crutches. So it can cover quite a few different needs. Some of the equipment we have is pretty standard, but we do have some specialty equipment as well. And then the Try-It room is a place where we have smaller, low-tech assistive devices that might be helpful to someone with a disability or an older adult in managing different tasks around their house. And the idea is you can borrow the piece of equipment to see if it will meet the need. And you can try different ones to see which one is best. And then we can help you find a place to purchase it. Occasionally, we do have an item that we have in greater number, and we can gift it again if there's a financial need there. So I think that covers everything a little bit. And if anybody has any questions, I'm happy to try to answer them.
Jan, this is Sue Ellen. I had a question with the role that they're proposing for you to be, I think you called it a facilitator.
Right.
Is there reimbursement for that role?
There is a very low reimbursement for that role. Previously, the way we were reimbursed for our services as a fiscal intermediary, it was built into the rate that was being paid to aides and how we were working with them. So they've changed that, and it is not really a rate that supports all the work that goes into helping a person, the time and the energy and the expertise that have to go into helping people. But again, because we really want people to not go without services, that's why we're doing it at this point. And we're hoping that at some point the rate can be negotiated to a better amount. But right now we're focusing on getting people signed up. I think it's more of a barrier for some of the agencies that are fiscal intermediaries who are doing several counties, because they have a payroll that's massive and they made more money from it. For us, we've stuck to pretty much Tompkins, a little bit of Tioga County. So, and the reason they wanted to change it is because there's so many people or so many entities that are in the system that have really misused it, but it's not most of the system. So it's one of those things where there was an ability there, we feel, for the Department of Health to kind of weed out the bad actors, the ones who were misusing it in certain ways. But instead of doing that, they're kind of throwing out the whole system and changing to this one. So that was a long-winded answer, Sue Ellen. Did you have,
Okay, thank
did
you.
that answer it for you though?
Yes, thank you.
Any other questions for me? Seems there aren't, unless it's in the chat, but that's probably all everyone's name.
I had a question. This is Karen.
Sure.
You had mentioned that you and I saw it on your webpage. The webpage looks really nice, by the way. I liked it when I jumped on there. That you go out and you do presentations to anybody who kind of requests them. How often do you get requests to go and talk?
Not as often as I think would be useful. Like many things with the pandemic, when it had to stop completely, I think there were a lot of connections lost at that time, and it hasn't really gotten back to what it was before. We do get different agencies, or sometimes we had like a fraternity at Cornell that was having trouble working with a person that was in the fraternity who was disabled, and they wanted more information about how they could, in a positive way, work with the person. So yeah, it's not quite what we'd like, but we're also very busy with everything else, especially the PPL piece. So we haven't been doing as much outreach to see if people need it.
The reason I asked is when Dawn and Andrea did their presentation on the Office of the Aging, they also talked about, they can go out and do a presentation and stuff. And both today with you and then with them, I think even though I know of the agencies and, I know all of you guys, I sometimes forget all of the different, services that are there. As well as I have tried to remind myself that when we have turnover or people come in and, they join our teams and stuff, they may not know, they may be coming from a different, background or things like that. And so the reason I ask is I'm trying to figure out how is this committee or, how can we help spread the word and get it out there? Because I think you also hit on something really important is I heard you say sometimes older people don't think about themselves, do you know what I mean, as being able to use this or those type of things. And I think that happens a lot of times, even like somebody who's had a surgery doesn't realize, do you know what I mean? Oh, for 6 weeks, I'm going to need this equipment kind of a thing. And then it kind of gets sprung on them, and they're not thinking that they even qualify or why would they call, these certain agencies kind of a thing. So I'm looking for ways that we can, how do we stay connected and make sure that our community does know about all of these wonderful services? Because I think that's a challenge is how do we get people connected? Because sometimes they don't realize they need or are eligible. So just wondering what other people think.
I can pipe in on that for a second, Karen. I know we've been talking about that for a while. It's Karen, I'm with the Office for the Aging. And I think that that's an excellent question. I think it's also a culture change. It's a mindset change. People hear long-term care services and they're like, nope, not yet. So I think we need to focus on the, promoting the proactive stuff instead of the reactive stuff. And that's a hard thing to get ahead of, if that makes any sense. You know, I always say in our public hearing, we're actually celebrating our 50th anniversary this year of our office being established in Tompkins County. So we've been around for 50 years and we still have people that are like, I didn't know you guys existed. I didn't know you were there. I didn't know you did that. So, I think it's there's no one good answer. I think it's a number of things. I think it's the culture shift. I think it's, combating ageism. I think it's rolling with all of the different technological advances and getting information out to people and what that means and the various ways that people receive information and having to accommodate all of those, various forms. So yeah, I mean, I think it's definitely an important issue, but I think it's a broader issue than just presentations and getting in front of people, I think.
Yeah, that's a really good point, Karen.
Mhm.
We used to go to apartments for seniors and other places that would be a gathering place for seniors to talk about emergency preparation. That was the main focus of what we were talking about, but I think it would be useful if we could do that again and talk more broadly about all the services. Maybe we could do that with you, with the Tompkins County Office for the Aging.
Yeah,
Time.
absolutely. And it's interesting because we actually just had our first outreach meeting of the year when we kind of start to plan out our year. And one of the things that we always try to do is to hit most, if not all of the senior housing complexes, as well as the various senior groups that exist in the municipalities. So that's kind of our goal. And then everything else is sort of, all that extra stuff. So, and actually, I think it's an actual requirement with New York Connects now that we do joint, I think it's 2 a year. So we'll be getting in touch with Ben about planning that. But yeah, it's always good to kind of double team some of these places.
Yeah, and it's been great when there are tabling opportunities.
Mhm.
We're often next to each other. I was next to Andrea at one years ago, and so
Yeah,
it's kind of a fun way to get out there and inform people.
yeah, definitely.
The Food Nets Mac and Bowl, I always get the name
The
wrong.
mac and cheese bowl.
Yes, there we go.
Yes. Mhm.
And having it down, I think, at the farmer's market has made like a huge difference. And when you just mentioned tabling kind of thing, it reminded me that it wasn't an excellent opportunity, you know what I mean, for us to get out and do some of that proactive stuff and supporting each other and things. And maybe looking at what are other opportunities that are similar to that. And looking at, like you're saying, you know, presentations, or, you know, what can we do? That is that proactive. I like both of the things both were saying. I think there's a lot of energy behind it that we could kind of get behind.
Yeah, and I think, I mean, inviting me to this meeting and other service providers, I think it's a great way to get the information partway out, and then it can go even further once people who are in the system or in services, I should say, helping services, can get out there and be aware of what they can offer people for assistance.
And just also, I'll do a little bit of a shameless plug as well. You know, our office does host the Aging Services Network meetings that occur on the second Friday of every month. And they're open to anybody in the aging field, as well as any member of the public who finds the topic informative. So if you either want to get on that list or you want to present, you know, you can certainly reach out to me, but that's another good way to get the word out, not only to, you know, potential clients, but also to service providers in our area. So.
Yeah. Yeah, and I'll just say that don't be afraid to call, because we try to figure out how we can help. And if we can't figure out any way to help, we certainly refer on to someone that we think could be a better help. The only thing we shy away from is any type of legal services. We don't feel that that's a good fit for our expertise. So that's not something we can provide.
Great, thanks. I think that might be an interesting thing too for us to collect maybe from our committee and others, like you're saying, Karen, you've got that really good thing that's already going. It's been going, you've been doing it for a while. Do you know what I mean? Like, how do we you know, we don't necessarily have to recreate the wheel. Sometimes we can just you know, either jump on or make sure that we're letting other people know, or making suggestions for who could, you know, go and speak, those kind of things. Because I think a lot of us were so excited after Dawn and Andrea did theirs, because they did such a wonderful job. Do you know what I mean? And it just, anyways, it just made me start thinking about those things. So if anybody has similar things that you do, or if you've got an idea for something, I think it would be a great way to start thinking about, you know, what can we go back to that we were doing pre-COVID that worked really well, and what can we do that new and exciting that's a little different based on where we're going. So I think it would be interesting. I know I've been talking to Nicole and some other people and Beth and stuff about, you know, what worked really well in the past. And so we are going to be working on trying to look at how we would like to do this meeting coming up in the future and some other things. So that's on the table. Are there, oh, go ahead.
I was just going to say, that sounds great. Sounds like you're doing a lot of work towards that end.
Well, I'm trying. I haven't done as much as we need to, and but Nicole and I are gonna put our heads together and try to come up with some suggestions and talk with Kofa and some others, and then obviously come to the group, do you know what I mean, and see how that's gonna go. But it's been great to be getting some feedback. Are there anybody else that had any other questions or thoughts on that before we transition into doing a go around? And
Well, Karen, this is Sue Ellen, and I want to apologize to the committee. I had a patient issue that was emergent, and I just couldn't join right on time, so I apologize for that. But I think it would be a good idea if we read some of the comments in the chat, Karen.
Oh yeah.
Okay. So one of them is, thank you so much, Jan. This was very informative. I had no idea Flick offered so many services. And then there's another comment. We've done, this is from Ben Bassett. We've done accessibility consultation for downtown Ithaca Local Development Corp., INHS and library and others, assistive tech collaboration with 3 different student-run organizations at Cornell in 24-25, just a few other notable things. And then I don't know who said this, but congrats on 50 years. That's for the Human Services Coalition. And then Beth Harrington wrote, mobility equipment in the lending closet at Flick is repaired and maintained by wonderful wheelchairs, who also are available for community members who need some sort of mobility equipment, sold at cost for repair costs for donated equipment or need their equipment repaired. They are located in the basement of Cuca Ridge. And then just a comment from the Human Services Coalition. Please let us know things that each of you do that we can support or attend. So thank you for all those comments. Very nice.
Thanks for catching that, Sue Ellen. That's really important, to make sure we get everybody's voice. And I said, I'm sure that something has come up, with Sue Ellen, so don't worry about it.
I know.
We know what your work is and we know how
Yeah,
crazy it
thanks
is.
for pitch hitting for me.
No problem. So I'm gonna swing it over to you and, let you take over from there.
Okay, well, I guess we're at, Jan, thank you very much for the presentation and, for what you're going through right now, with the whole program. I know that there's a lot of controversy and turmoil over the whole thing, and I hope it works out to your advantage and our community's advantage for sure.
Yeah.
And so I think we covered everything that was on the agenda. This is where we just open it up for anybody else to, give us information that you'd like the committee to know about your organization or just any announcements. Does anybody have anything?
You have some, actually.
Yes.
So I just want to throw out some dates for everyone to kind of plug in on their calendar. First, I will say that the Mac and Cheese Bowl this year is going to be Wednesday, May 7th. So put that on your calendars. Our office, the Office for the Aging, will be having our annual luncheon this year, again at Hotel Ithaca, and that date is Friday, May 9th, noon to 2. So invites will be going out for that shortly. I also mentioned that, it's the 50th anniversary of our office being established. So with that in mind, we are having a little celebration and we're bringing back the Senior Living Expo for those who remember that.
Yeah.
Yes, Karen, you were a huge part of that. So that date will be Friday, July 25th. And I believe the hours will be 2 to 5. I'm not 100% sure. We're going to be sending out save the dates. And that too will be at the Hotel Ithaca, and that's going to involve our Senior Living Expo, which for those who remember, we used to have it at the Ramada, and it was always in partnership with the Ithaca College Gerontology Institute. The last one that we had scheduled was in 2020. COVID hit, so we had to cancel, and we haven't brought it back yet, but it's a great event. We usually have between 30 and 40 vendors that come to that, many of which are on this call. And then we will be having a breakout session on a specific topic for people to attend. And then Greg Olson, who is the director of the New York State Office for the Aging, and Becky Prevey, who is our state association director, will be with us to give a small speech on our 50th anniversary. So again, I will be sending out save the dates to those who wish to table at that event. So stay tuned for that. And if you have any questions or thoughts about that, you can certainly shoot me an email. And then the last thing that I just want to say, and I put the link to our flyer in the chat, is that I did send out, we are now looking for nominations for our 2025 Outstanding Volunteer Awards. So this is to recognize, Lisa just walked in my office and so anyway, so that is to recognize any older adult in the community age 60 and over who you feel should be recognized for their volunteer activities. We would love to hear about them. We have a subcommittee of our advisory meeting who makes those choices. And then we recognize those, we pick 2 and we recognize those volunteers at our annual luncheon. And then they will also be recognized in Albany at NYSOFA's Older New Yorkers Day, which is also in May. I don't think I have it on my computer. I'm not sure the date of that. It's in the flyer, but they're welcome to, oh, I'm sorry. It's the 27th of May at 1 o'clock. And that takes place in Albany at the Desmond Hotel. So they can also be recognized there. So if you have anybody that you want to nominate, you can put it in the form of a letter and shoot it over to me. I believe I put the deadline as February 28th for nominations. So please share that broadly.
Thank you. Is there anybody else who has an announcement?
I'd like to make some, Sue Ellen. We have been working with the Office for the Aging, with Meals on Wheels and Lifespan out of Rochester, and with the Sladeville Volunteer Fire Company. Starting in mid-March, we're going to bring a caregiver respite program that we will host at the fire department, along with congregate meals or social dining that will be available for people over the ages, I believe, 60. But we have been working with those people, and we started that with what we call a community resource group. So I was thinking, when you were talking about getting information out to the public, we're meeting once a month, and we've had people come out like Doris Green from Respite Programs and Allie Evans from Meals on Wheels, and talk about their services. So if somebody's interested in doing that, I'll be glad to facilitate that also. But we're really excited about bringing those services to our little rural community in the town of Caroline.
That's great, Beth. Anybody else have any announcements?
I do. Hi, this is Thina with Love Living at Home. Most of you probably saw that we put a call out actually just a few weeks ago for a services coordinator for Love Living at Home. I am thrilled to announce that we have hired for that position. We had some wonderful applicants, but Ella Elizabeth Brooks is here with us today, and she has started training a few hours with us just this week. So Ella, if you would like to introduce yourself, I'm sure the committee would love to meet you.
Hello, everyone. Thank you, Thina. Yeah, I'm really delighted to be part of Love Living at Home. I've been in Tompkins County for about 10 years now. Prior to that, I was in Tennessee, a rural area in Tennessee, and we started a village there from the ground up, a friend of mine and I did. So I have a lot of experience with the villages, and I really believe in aging in place. I also work as an in-home personal caregiver, and I've also for a few decades worked as a death doula, moving right through to the end of life and coordinating everything that it takes to do that. So this is something I'm really passionate about. And so I'm just really excited to be plugging in at Love Living at Home. Thank you, Thina.
Thanks, Ella, and welcome.
Several messages in the chat saying welcome and congratulations, Ella. Welcome to the group. Nice. Any other announcements or anything people want to cover?
I have one. So February 25th, we're going to have a teach-in. We do them monthly. We do teach-ins for different topics for the community members asked us to cover. And February 25th, we're going to have complaining about hospital care to the New York State Department of Health. So that will be, the speaker will be Lori Schillinger. RN Deputy Director, and Stephanie Schuleman, MS Director, Division of Hospitals and Diagnostic Treatment Centers. It's free to attend over Zoom or by phone. You can register right on our website. It's from 10 a.m. to 11 a.m. So that's something that's coming up. And we did a budget briefing. Gail, our Deputy Director, does a budget briefing every year for the New York State budget. She did the first one earlier this month, and she's going to do a second breakdown as well. So she kind of just takes all the different parts and breaks it down for the things that are relevant for the senior issues, which are relevant for everybody on the call. Different funding things, disability things, different things that are changing with the budget. Moving forward for the new year, so that'll be coming up, the secondary budget briefing that she does. We do free teach-ins every month. And we also have a weekly roundup that we do that's free if anybody wants to sign up, which comes out in email every Friday. And it's just kind of a roundup of different things that are going on. We'll do call to actions in there. We'll let you know things are happening in different fraud capacities, if there's a new Medicare fraud happening, if there's different things that are popping up, just to let people know what's going on. Those are free. And we also have a monthly fraud toolkit that goes out if you want to sign up for that as well. It comes pre-packaged with newsletters, social media blasts, articles, and it's a different fraud each month related to Medicare that we put out that you can then disseminate out to your agencies, and kind of makes it easy to get the information out to the people that you work with and with your agencies. If you guys don't know, New York Statewide Senior Action Council is the federal grantee to handle Medicare fraud for New York State. So we handle any Medicare fraud issues in the state. We do free presentations, but we also handle patient rights issues and Medicare counseling too. So those are other things we do, and we cover the whole state. So it doesn't matter what county anybody is in, what zip code they are. So if you have anybody that's outside of your service area that you're like, I don't know, like if you're limited by your service area, we can definitely help because we cover every place in the state. So just some things to know for us that's coming forward. The weekly roundup is usually really good. The fraud toolkit's great because it's all prepackaged. You don't have to really do much with it. You can just kind of put it out, which is nice. Anything that makes stuff easier these days, I feel like, is good. So, and we'll also use the weekly roundup to keep people abreast of changes. Like for instance, the $2,000 cap that went into effect this year for Medicare for prescription drug plans and the payment plan and things like that. If there are any changes to those things under the current administration, we will keep people abreast of those things. If any changes do occur, that's something that we will let people know in the weekly roundup, stuff like that. So just moving forward as things change or do not change with the new situation we all find ourselves in. So we're kind of just keeping an eye on things and just keeping as up to date as we can. So we are giving the best information to beneficiaries when they call us to make sure that we're operating as best we can with the most current information. I know we're all having things with, the Medicaid changeover that we're talking about and all those things, just trying to keep it all together so we can be the best we can for the people that we work with.
Thank you, Sarah.
Yeah, no problem.
And I just, there's an email from Karen, or in the chat, says, please email, and this is Karen's email. It's kbrown@hsctc.org, your events that you just announced, so she can be sure to get them in the minutes, and get them out to
Absolutely.
everybody.
I
Anybody,
Oh,
anybody
as a-
else?
Yeah, I do have a quick announcement, and I'll make it short and sweet, but I'm Stephanie D'Amico. I'm a program manager from the Alzheimer's Association, Central New York chapter. My territory is more the southern tier, so Tompkins County is one of my counties I cover. But I did want to let everyone know that we are going to host our Dementia Care Conference again this year. It will be May 28th. It is in East Syracuse at the Doubletree Hotel. It is both for informal and formal caregivers. What's nice this year is that we will have a virtual option available. Since we cover 14 counties, we realize that not all of our constituents can travel in, so we will have it available virtually for constituents this year to attend. And the other nice thing that we are going to have available on site is respite care. So we will, it is limited, but we will have free respite care for caregivers who need to bring their loved one with them, so that they can attend the conference. And I will make sure that I get all of those details out so that you can share those with families who are interested, perhaps if you want to come as well. We do also have vendor opportunities available. So if that is something that you're interested in, I will make sure to email that over so people have, both packets, and can, get back to me, with your interest, about, possibly attending.
Okay, thank you.
Thank you.
Thank you. Anybody else have announcements? Okay. I do not know the next meeting date. Nicole, do you happen to know that?
It is May 2nd.
May 2nd. Okay, is it at noon again?
Yes.
Okay, so May 2nd is our next meeting. All right. Well, I think with that, we'll close out our meeting, and a big thank you to all of you for everything that you do in our community. I know it means a lot to everybody, and Jan will be rooting for you. Okay, thank you. Bye now.